Hi everybody, it's David Porter. Today I want to talk about substance abuse diagnosis and treatment. And the diagnostic methods and treatment methods I'm going to outline can be broadly applied to pretty much all chemical substances, whether it's alcohol, heroin, or one of the other opiates, cocaine, methamphetamine, cannabis. It is these treatment methods and diagnostic methods are widely applied throughout for a variety of substances. So treatment has to be predicated upon correct diagnosis. How is an individual diagnosed as chemically dependent? This is done through a series of procedures, the first of which is going to be a diagnostic interview. This is a 60-minute to typically it's 60 to 90 minutes. It could be up to 3 hours, spaced out over several sessions, in which a history will be taken by the clinician. In other words, the patient will be interviewed and asked different questions in different categories, such as your general background information. Where are you from? Married, single, divorced? Do you have kids? What do you do for a living? Highest level of education, military experience, hobbies and interests, religion or faith, family system. What do you have kids? Extended family. What's your network of peers and friends like? What was your childhood, and how was your childhood and your teenage years? You're going to gather some basic background information. You're going to look at their former treatment history. Have they ever been to a substance abuse rehab before? Have they gone to AA? Have they received treatment from other outpatient therapists? Or have they ever been to an inpatient psychiatric facility? Do they take meds for their mood provided by their primary care doctor or a psychiatrist? So you're going to review their psychological treatment history. You're going to review their medical history. Are they taking any meds right now? History of serious injuries, surgeries, chronic medical conditions, severe life-threatening history of severe or life-threatening medical conditions, allergies to any foods or meds. You're going to obtain a legal history. Have they ever had involvement with the criminal justice system? If so, what were they charged with? What were they convicted of? Have they been incarcerated? Are they currently out on parole, probation, or house arrest? Do they have charges pending? Do they have warrants in other jurisdictions? You want to gather up information about any involvement with the criminal justice system. You want to assess for trauma. Have they had potentially traumatizing experiences, and if so, do they also fit the diagnostic criteria for post-traumatic stress disorder, PTSD? Or have they had chronic stress and repeated traumas, and do they fit the diagnostic criteria for CPTSD, which is complex post-traumatic stress disorder? You want to look at do they have any risk factors for self-harm? Have they ever deliberately cut themselves or burned themselves? Have they ever had suicidal ideation? That is, have they fantasized or made a plan, fantasized about killing themselves, made a plan to kill themselves? Have they ever acted out this plan? Have they ever tried to take their own life? And if so, by what method, and how close did they come to doing it? You want to make sure to know if they have any current thoughts of wanting to harm themselves. If this is something that they had entertained in the past, or if it's on the table right now, today. Critical information. So this is all going to be information gathered by the by just interviewing the patient, by asking him questions. And then you're going to get into the substance abuse specific area. And you're going to have a list of commonly used substances and inquire if they've used them remotely, meaning going back 10, 20 years. Have they used them recently, meaning within the past 6 months? Or are they using them currently, meaning within the past month? And if they are using anything current, well, past, present, past, current, recent, or remote, or the present, you want to know how much and how often. How much did you use? How often did you use? The route of administration. I mean, some like alcohol, obviously PO route, oral. If they use heroin or cocaine, that can be used through the nose or intravenously. Methamphetamine can be used through the nose. It can be injected. It can same with cocaine. It can be injected or used through the nose. Other amphetamines injected, used through the nose, or taken orally. So you want to find the route of administration. You want to know the route of administration. You want to inquire if their use has had any type of consequence or impact on their life. Have they lost jobs? Have they had trouble with the criminal justice system? Financial problems? Divorce, DCF getting involved because of concerns about their ability to care for their children. You want to look at have they ever been charged with a drug-related crime, a possession or distribution. You want to try to get a picture of their use, and you're going to be primarily looking for three things. Do they have high tolerance? Are they using or do they have to use a larger amount of the substance or higher potencies than when they first started? Has there been progressive tolerance? Number two, do they have withdrawal? When they stop using, upon cessation of use, did they get withdrawal symptoms typical of the substance they have been using? And number three, compulsive use, despite having identified that there's been an impact and there have been consequences to them using. Those three things: high tolerance, withdrawal upon cessation of use, and compulsive use despite consequences. Those are the three main criteria for addiction to drugs or alcohol. Now, so far, this is all the self-report of the patient. What you're going to be doing during the interview is close observation of the patient. You're going to take some objective measures. I like to look at people's eyes because you can tell if someone has used. If their pupils are pinpointed, that means they have used an opiate. Their pupils are blown up, that means they have used a speedy drug like cocaine, amphetamine, or methamphetamine, or they're coming down from alcohol. You want to look at their skin. Are they sweating at room temperature? That's an indication of either opiate withdrawal or alcohol withdrawal, or that they've recent use of amphetamine, cocaine, or methamphetamine. How is their hygiene and their attention to grooming and their appearance? Because people, and I'm not trying to be disrespectful or insulting, this is the reality, people who are using drugs and alcohol compulsively, habitually, their lives have become unmanageable. Their lives are unraveled, and one of the first things that goes out the window is personal hygiene. They no longer attend to their appearance, and they tend to be disheveled, and they're going to have body odor. They're not going to look good or smell good, and that's just the reality. Like I said, I'm not trying to be disrespectful or insulting. That's the reality. They're going to look pretty rough. You want to look for their mannerisms and their motor activity. Are they looking all around? Do they seem to be responding to things that only they can perceive? Because that can happen coming down from alcohol, can happen when loaded up in amphetamines or cocaine. You're gonna have psychotic experiences. You're gonna get paranoid. You may see things or hear things that aren't there. Are they very restless? Are they unable to sit still? Are they engaging in a lot of self-grooming behaviors, where they're touching themselves, running their fingers through their hair, well, assuming they have hair. Are they fidgeting? Are they engaging in those self-grooming, self-soothing behaviors? And that's not conclusive, as I noted in my video on cocaine and amphetamines. That can just be anxiety. Are they? Do they smell like alcohol? And are their eyes red? That can indicate alcohol use, or it can indicate that they have smoked cannabis. And something I will do, I will ask them to follow my finger or a pen with their eyes without moving their head and watch their eyes. I'm looking for gaze nystagmus, which is another indicator of recent use. With gaze nystagmus, your pupils are not going to smoothly track a moving object. They're going to bounce, especially when you get to the corner of the eye. You may see this. The pupils may smoothly track, and then the corner, they'll bounce. Or they may not smoothly track at all. They may just bounce when they're moving. Oscillation is probably more accurate than bouncing. So you want to look for gaze nystagmus. You want to look for the size of their pupils according to the ambient light in the room. Your eyes tell a lot about you. You want to look for contradictions and inconsistencies and discrepancies, because they are probably going to be lying to you and withholding, and some of it is going to be deliberate because of fear of consequences or shame. Some of it is they may not recall, or they may not completely understand your question. So you are going to be looking for deception. You're going to be looking for contradictions and inconsistencies. And everyone, again, I'm not trying to be disrespectful, addicts will look you in the eye and tell you a lie so convincing you will believe it even though you know they are lying. You will doubt yourself even though you know they're lying. They're very, very good at deception and manipulation. They've had to look into their own eyes for a long time in the mirror and tell themselves, I can stop anytime I want, everything is okay, I don't use as much as other people do, I've got this under control, and they know it's bullshit. And they have to tell themselves these lies in order to continue using, because their brain has been hijacked. They have a compulsion to use. The other thing is, there are people who, in addition to their substance use, they have some sociopathic personality traits. Either they are actually, sociopathic, narcissistic, Machiavellian, meaning ends justifies the means. That's their belief system. Narcissism, I'm so superior to everyone else, the rules don't apply to me, malignant narcissism. Or sociopathy, meaning they actively reject rules, laws, and norms of behavior and prohibitions. All three of those features, the narcissism, sociopathy, also known as psychopathy or antisocial personality, and Machiavellianism are all interconnected. They tend to all be wrapped up together. And the substance abuse is just another symptom. It's just another means of self-destruction and rejection of societal norms and compulsive violation of the law. And not all addicts are narcissists, sociopaths, and Machiavellians, but some narcissistic, sociopathic Machiavellians are also addicts. And they're going to work you. They are going to work you. Their deception is deliberate, and they are watching you as closely or closer than you're watching them. And they are primarily information gatherers. They are going to be sucking up everything about you and looking to determine your needs, your emotional and psychological needs and wants. And they're going to deliver what you want to hear smoothly and flawlessly with great charisma and articulation. And it's a game to them. They're not interested in recovery. Well, if they are, maybe. If they are, it's so they can become a better criminal. They're finding that use of drugs and alcohol is muddling their ability to carry out criminal acts. They want to become a better criminal. So they are going to, maybe they really are serious about sobriety, but for very for very dark motivations. Or they were sent to you by the Department of Corrections. They are acting under a court order to see a drug and alcohol counselor for an evaluation, and this is just a game, and you're an obstacle to their freedom, and they're going to tell you what you want to hear to try to get you out of the way. Or they're going to work to intimidate you. Here's a way that sociopaths, narcissists will try to intimidate clinicians. They won't threaten you directly, but they will give you very vivid, detailed descriptions of the violence they've carried out against other people. And it's a subtle warning about how dangerous, listen to how dangerous I am, and you don't want to cross me. You don't want to upset me. You don't want to get cocky with me. It's a very subtle means of intimidation, but it's something that, again, the sociopathic personality will use. So, now I don't want to make this video about sociopaths, narcissists, Machiavellians. I've done other videos about that. I want to stick with substance abuse. And again, emphasis on not all addicts are like this, but rather some people in that dark triad that I mentioned several times are also addicts. And you have to be aware that they're out there. And again, all addicts have the propensity for deception and manipulation. You cannot trust anything they tell you until it's verified. More about that in a second. You cannot be effective if you're naive. You cannot be effective if you have misguided compassion, because there's a lot of rhetoric out there today. Addiction is a disease. People who are addicts don't need to be incarcerated. They need treatment. Yes, addiction is a disease. Yes. It is genetically transmitted. It's neurologically based. It is also maintained by behavior, which initially is a product of free will, and you could argue over time, as one descends deeper and deeper into addiction, free will is lost. You are possessed, if you will, by the drug. Your brain has been hijacked, and you may no longer have free will to act. That's a possibility to entertain. But the first drink, the first drug, you had a choice. You had a choice. It doesn't have to be that way. And again, as I've discussed in other videos, there is no such thing as an addict gene. It is a sensation-seeking, thrill-seeking gene, and people, depending on their own choices, and of course a lot of environmental factors, are going to go in different directions with this. Addiction is just one of them. Some people are going to become warriors, rescuers, place themselves in harm's way and in danger to either crush the bad guys, stop evil from perpetuating, or to rescue people who are in danger. Police officers, firefighters, other first responders, EMS, corrections, military. You're going to have people who indulge in high-risk sports, whitewater rafting, rock climbing, rappelling, mountain biking, surfing. They have their 9-to-5 job, they're in the office or factory or wherever, and live for the weekends when they can go out and do their adventure sports. So people get that craving, that insatiable urge for dopamine in different ways. Addiction is this one. Other people commit criminal activity, compulsive criminal acts, which are senseless to people looking on the outside looking in, but make perfect sense to the person doing it, because it's a rush, it's a thrill. Watch Point Break, the original 1992 Point Break with Keanu Reeves and Patrick Swayze, Lori Petty, Gary Busey. It's a great movie about a tight-knit group of men who they surf, they skydive, they rock climb, and they also rob banks. That's a very good movie to see dopamine deficient individuals in action. So, I digress. What's new? Hopefully I'm digressing to useful places. Where was I? Evaluation. So you want to verify what you're told. How do you do that? The best way, first you do it through clinical observation, which takes training and experience. Secondly, this is just an overview. This is not how to be a clinician. This is just an overview of the evaluation and treatment process. It's going to be a long video. It's probably just going to be an overview of the evaluation process and then treatment and another video. So you have to observe the patient with trained and educated eyes. You have to know what to look for. That's number one. Number two, paper and pencil tests. Most of these tests are no longer literally paper and pencil. They're done online. They're done like in electronic health record format. They're still called paper and pencil tests. Majority of them are completely useless. I don't use them unless a referral source requires me to. I don't really find them to have any reliability and validity. In the at least real world external reliability and validity, for a very simple reason. It's very easy just to withhold or fabricate or exaggerate if you're malingering for secondary gains, or to lie on any of these tests. They're all based on self-report. Here's the best way to tell. Urine toxicology screens. Enzyme immunoassay screens, which involve the patient pees in a cup. The urine is tested for metabolites and broken down byproducts of the parent drug, the drug that they used. It has a very, very high order of reliability and validity, 99% plus. If there is any doubt, because mistakes do happen and 99% is not 100%, and when you get a large enough sample, if you're looking at 1,000 urine samples, and you could quickly get that number, you have 200 patients in the clinic and you're doing 3 tests a week, you're going to get to well over 1,000 before the end of the month. You are going to get some false positives. So then they do GCMS testing, gas chromatography, mass spectrometry. This is a true test. If you want to be technical, enzyme immunoassay is a screen. It involves, typically, a stick is dipped into the urine sample, and the urine will interact with chemicals the stick is impregnated with, which will turn a certain color if a certain drug is detected. That's one method, but technically that's not a test, that's a screen. GCMS, gas chromatography, mass spectrometry, is much more advanced, much more in-depth. It's a test. It's conclusive. It is close as you're going to get to a 100% reliable and valid test, which will determine presence of metabolites in the urine sample. There are procedures in place where the patient giving the urine sample, they have to wash their hands, and they're going to be observed by staff. I always hated doing that. I had to, because I had to go in the bathroom and watch another man pee. That was not a pleasant activity for either party involved, but it was necessary. You have to watch them pee, and then you're gloved up, and you take possession of the cup. They screw the cap on, you take possession of the cup. You must maintain chain of custody. That cup cannot go out of your sight until it is handed off to another staff, probably a technician, and then the technician does the testing. If you lose sight of the sample, the chain of custody is broken, the test is invalidated. Details matter. The top is removed from the cup. It must be placed with the flat side down on the table. If it's placed with the side facing the table that was basically exposed to the urine, the test is invalidated because it can get contaminated from the surface. You have to go through these procedures to maintain the integrity of the sample. Okay. I think that more or less covers evaluation. And again, this is just an overview of a very complex topic, an introduction. So, another video I will talk about actual treatment methods. So, I want to thank you for watching. Please hit subscribe and be safe.